thing.
That is exactly, that is the kind
Result.
of, that is the awareness which we are trying to create through our foundation.
Okay.
We're telling people, listen, this is not something which you're doing for cosmetic reasons alone, but you have to understand that there are a lot of things to your oral health as well. Surprises. I mean, we are trained to not get surprised, so I don't know. Mm.
Okay. Okay. What are the ways in which, like you said, one of the problems that is happening now is that people are reading up and they've diagnosed it and come and say, I need a root canal, or I need this, or it's almost as if they've arrived at a conclusion.
Uh, Generally, what I also tell my patients is, now that this is catching up, as in preventive dentistry is slowly catching up, the first appointment with your dentist right now, I mean, if you have not been to a dentist in the last 10, 15 years, or never in your life, the first appointment is always going to be really expensive, because we'll have to holistically correct everything in your in the patient's mouth. We'll have to take a I mean, it's just not about addressing the patient's complaint alone. I mean, if the patient says, I've got complaint in the lower left backtooth region, I mean, we don't just address that complaint alone. We'll have to tell the patient that these are the problems that you have, and if you don't get it corrected, then these are the complications that can happen, and that, I mean, it'll further cause a lot of hindrance to their day-to-day activities as well. Also,
Okay.
yeah.
And the changes in dentistry, I think we briefly spoke about it yesterday when I touched upon where you used to have braces have now been, at least to some extent, replaced by the Invisalign, which is more cosmetic or the thing. So, what is your take on the old versus the new ways of correcting the alignment of teeth?
I mean, we are a country of a population of about 140 crores, and we have a lot of mouths to deal with. I think people have to just just keep be a little patient, and make sure that I mean, they will get their dentistry is a fantastic field. I mean, it's a very good field, of course, and all we have to do is stay a little patient, hope that it will change for initially it might be a little difficult, but then as days grow, as we gain more experience, automatically things will